of a sudden everybody's very quiet. Wow, that's impressive.
Okay, everyone, we are live. You can begin.
Okay, I will call the meeting to order and remind everyone to please disclose of any pecuniary interest that they may have at the appropriate time. And we are going to go right to our friend Dr. Renaday, who is here with a health update on COVID-19. Hi, Dr. Renaday. I'm going to ask you to turn your mic up a little bit, please.
All right, here we go. How's that?
Perfect. Thank you.
Great. Thank you. Good morning, everyone. Good morning, everyone. It's the PM committee, so I got a little confused, but good morning. So a very brief update for today. We have 365 total cases recorded at this point. Nothing in the last 24 hours, but between the last time we've spoken, there's been a little uptick in cases. We were able to identify those as well as their contacts and isolate them, reassuring that they're connected through social networks of people getting together socially. But what we're seeing is that in this new situation where more things are open, right? A small amount of contacts in a social network can actually lead to a number of other contacts in workplaces, in schools, etc. So we have recently declared an outbreak in a long-term care home because the criteria for that were met, which was one case related to that facility and an outbreak in a workplace. Now, as we monitor those, it doesn't appear that there's sort of ongoing transmission related to those, but it's still, we wait for these things to play out, and there's still a time frame for us to be able to declare those outbreaks over, and that time frame hasn't passed yet. So we're watching and we're waiting, but reassured in a way, so cautiously optimistic about those ongoing outbreaks. And 2 more recoveries leads us to 331 resolved cases. And then the bigger things now are just to note that, as I said before, cases result in a large number of contacts, especially where they're associated with things like schools. We have had 3 school-related cases that have not resulted in the declaration of outbreaks, but have resulted in a number of cases being and contacts being isolated successfully at this point. And the processes that we've got with the school boards in place to have all of that stuff happen, they've been tested sort of in rapid succession over a 2 or 3 day period, and they seem to have worked out okay from our perspective and also the board's perspective. So not that every situation will have little things that people are commenting on, but in the bigger picture, it seems to have worked out well. Other than that, no major developments in terms of vaccines, just ongoing. We're watching that situation, and developments in the testing world are that rapid test has been approved by Health Canada, right? Abbott, as well as maybe another one, but the supply list for that is very lengthy, and so it'll be a while before any of those tests make it our way. There's a federal kind of process for procurement, and then it goes to provinces, and then there's some kind of priority assigned to those things, and so that's all kind of underway, but it'll be a while. And then finally, just we did release the geographic mapping update. We're going to try to figure out if there's a way that people could expand the map so that they could see that more easily. We're working to try to make that happen. But in general, cases have been linked to their place of residence, according to the terms that we all discussed about a month ago. And the real, issue in terms of the timing on that was the subdivision of the within municipal picture. And so assigning dissemination areas and an algorithm to make all of that happen took a bit of time, but it is up and running right now. The important main message there, right, is that it shouldn't be used for people to determine their personal level of risk and not to sort of falsely feel secure in places that haven't identified lots of disease based on place of residence, and not to feel falsely insecure about your safety in places that seem to have more cases, because it's really just the place of residence of the case and not necessarily the place of exposure. Also remember, because of the time lag, we're talking about identifying cases based on transmission that occurred 1 to 2 weeks ago, right? So even the cases that we identified in this uptick, their exposure was actually a few days before the Thanksgiving weekend. So Thanksgiving exposures we would expect to see sort of now and maybe a little bit later, but we haven't so far seen them yet. I think I'll leave it there. Thanks.
Thank you. Does anybody have any questions for Dr. Renade? Councillor.
I have a question related a little bit. I brought it up at the last meeting in regard to the shortage of the flu vaccine in the city, in the area. One lady was unable to get an appointment for a flu shot. Another lady called me up and she said her pharmacy told her that there's 500 people ahead of her. So what I'm trying to say, Doc, is that there is shortage and there is a matter of concern in the community. Many pharmacies saying we don't have the vaccine. We're short of it. It comes and immediately gone. Is there a way you think we can look into it and help?
Sure, Councillor, good question. I think that it's an ongoing issue around the province, right? So the way the system works is that the province orders vaccines, it's kept at the Ontario government pharmacy and then distributed in lots and allotments. So the process is really when they get it, so there are manufacturing delays, but they get it in a series of shipments, then they take those shipments and send them out to across the province. And then health units, in some cases, are responsible for reallocating once it gets there. So we do that, but some pharmacies receive their allocations directly. And so it's a bit of a mixed or parallel system of how pharmacies and other places get their vaccine. But there's two issues that are ongoing. One is that, of course, people who are over 65 and eligible for the high dose vaccine are often much more interested in that than they are in the regular vaccine. It's important to remember that the regular vaccine is still very protective against flu. And so if you're in the situation where you're over 65 and you have the option of getting a vaccine and it's not high dose, you should still take that option, right? So some people really want that high dose, and people, when it's available and when people can get it, that's reasonable as a preference. But in general, whether it's high dose or regular flu shots, we want everybody over 65 for sure to get one or the other at least. And then I guess the other piece to that then is that there are many opportunities or access points for it, right? So public health is doing community clinics, primary care providers are offering flu shots, but depending on how they've decided to do it, some will have clinics, some will just do it in their regular way, and then the pharmacies. So there are lots of access points, but there is certainly a supply chain issue that is kind of constantly in flux, right? So we get shipments, we distribute them, they're taken up almost immediately. We get a new shipment, we distribute it, it's taken up almost immediately. And that's the pattern that you see across the province. So there will always, in all of these situations, be people who don't get it when they want it or don't get the right one when they want it. But on average, I think it's sort of at this up and down pattern where we get it, we send it out, we get more, we send it out.
Thank you very much for your answer. As long as you're aware there's a problem. The other question I have is...
Can I just interrupt you? Councillor Cook had his hand up first, so I'm going to go to him and then we'll come back around. We'll circle back to the Councillor Boucher.
Just a follow-up, and I won't be long. Do you know if most of the doctors are operating in their offices now or not?
I know that a lot of primary care providers are operating. I don't know if they're doing it in office or doing mostly televisiting and then saving the in-office visits for the ones where they deem that there needs to be an in-person visit. So it really is up to them to decide what requires an in-person visit and what doesn't. They have all these codes that they can use for televisiting as well as codes that they can use for in-person. And they're all kind of, I would say it's across all across the map. People are doing kind of what seems right to them based on their practice and based on their level of PPE and all of those things.
Thank you.
Thank you. I'm going to go to Councillor Cook and then Councillor Hand, followed by Councillor Stark. Councillor Cook.
Yep, thank you, Jackie. Through you to Dr. Renade. Just regarding the map that just came out, the showing like the cases. When they have, you used the example yesterday on the radio with Sue Storr talking about a possible somebody working at XYZ company in Sarnia who lived in Forest, for example. So the tracing goes back to where the person lives as opposed to where the outbreak actually would occur. Is that the way the map would read?
Right. So thanks, Councillor. The map is actually assigned to people's primary address of residence.
Okay,
Yeah.
so in the case of it was a business where there was, I guess I would say retail with food, and there'd be a lot of customer contact, that would be something that the public would be found out about. They'll be told to the public if that happened. Same as in London, where they're talking about a possible outbreak at a fast food restaurant and a grocery store type of thing.
Yeah, it's a good question. So it wouldn't be identified by the map, it would be identified by our risk assessment. So if the risk assessment shows that there may have been significant risk or meaningful exposure, and then we need to notify people for the purposes of taking a particular action, then we will do so. But in absence of that, then we don't, because in many of those circumstances, you know, I understand some other health units might be making notifications around that, but there's very little indication that there's the spread of disease through those kinds of mechanisms. And so then we wouldn't really issue a notification because there isn't the indication of risk or the need for people to take a particular action.
Okay. Thank you.
Thank you. Councillor Hand. You are muted. Your microphone is off, Councillor.
Related to what Councillor Boucher was saying, I booked my flu shot yesterday. It was a very simple process. There was all kinds of slots available, so it's very precise. Like I go at 9:15 to Rexall on Cathcart, and October's full. They were booking into November, lots of spaces. My husband booked at Sarnia Pharmacy, and he goes on Friday for his shot, so he had no problem either. I don't know where the individual is calling that you're talking about, but I think there's lots of appointments available.
That's good to know. Thank you, Councillor Hand. Councillor Stark.
Yeah, again, following up on the same point, the questions and comments that I'm receiving are that the high dosage is definitely in shortage. What's happening is people are showing up for their appointments, they're asking for the high dosage, and they're being told almost uniformly that there are no high dosage shots available. So is there a way that we as a health unit can register our lack of satisfaction with the province in terms of what appears to be a significant shortage of high dosage? And further, I've also been told that if the person opts for the regular shot versus the high dose, that they can't go back or should not go back and ask for a high dosage booster, if you will. So I'd like your comment on that.
Sure, thanks. So I'll handle the second one first, probably because it's easier. There's no indication to have multiple doses of flu shots in a season. So it is part of it is a medical consideration that you actually don't need the boosting. The other piece is the provincial eligibility criteria, which basically say that you're eligible for one immunization in a season through the universal influenza immunization program, right? So I think what's happening is a disconnect between the timing at which people would like to have a high dose vaccine and the timing during which that vaccine is available. So I'm going to go back to the first question about registering discontent. So there are lots of avenues by which the board can do that. The board could send a letter to the province to say it's important to get more high dose. I think the province is largely aware of that. I think the issue is some manufacturing and supply chain issues that are causing batched delivery of the high dose vaccine, right? So it's very possible that in the moment that you register your discontent, days later we would receive a shipment of high dose vaccine because it was expected, and it would really not have anything to do with the letter, just due to the fact that we were already expecting some. So we are expecting to receive ongoing shipments of high dose vaccine as it becomes available to the province. You will hear that people will say, oh, I want to get it now and I can't, but we want them to get it at some point in the early course of the flu season. And in terms of managing or mitigating their risk, getting it now versus getting it a week from now, 2 weeks from now, 3 weeks from now is not going to materially affect their risk. So the important thing is to get it during the season. I would say obviously by January, it's sort of, now you've missed a really critical window. But in October and November, you really haven't. So at any point during those months, getting the flu vaccine is a reasonable thing to do. And I think just keep in mind that because of the time lag between sort of advocacy that might happen here versus the already ongoing piece of distributing and delivering the vaccines, there may be a mismatch between the desire to sort of say we need to do something about this and the fact that it's already happening and we would be receiving shipments. So, but you do have that option of some kind of letter or something like that.
Thank you.
Are there any other questions for Dr. Renaudet? I did have one regarding Halloween. What is your recommendation for our communities on the 31st?
Okay, thank you. So we have, I believe, put out some recommendations around Halloween. The basic principle of Halloween, I believe, for our community is this, okay? 1, it's a one-off event. 2, in most places, it happens mostly outside, and we've spent months and months telling people that outdoors is safer than indoors. 3, the contacts that you would expect from kids getting candy are not what we would consider close contacts. They're what we would consider transient contacts, and therefore they, as well as the idea of just popping from door to door and getting some candy, like the process of it, do not entail a significant increase in risk, right, of COVID transmission. What does entail a significant possibility of risk for COVID transmission is the idea of grown-ups having Halloween parties or families having Halloween get-togethers where maybe you get together and trade candy and things like that. It's the close social contact that we want to make sure is reduced in terms of disease transmission. So given that Halloween is a one night, and what we're trying to do over the next many months is reduce the overall pattern of close social interaction, I have fewer concerns about Halloween activities as long as they're, just use sort of reasonable sense. If you're not well, don't go trick-or-treating. If you're not well, don't give out candy. Beyond that, and try to avoid the metabolic risk of the post-sugar high. But other than that, right, so we really need to start just shaping that conversation around risk and saying this is a really low-risk activity. It's not an activity that I'm worried about to a meaningful degree, except for the piece around grown-up socializing and parties.
Okay, thank you very much for that clarification. Is there anyone else that has questions for Dr. Renaudet? Warden Weaver, please.
Yeah, not a question, just I did at the AM committee express our gratitude to the health unit for putting together the map. I know it was a lot of work, and I understand they had help from our IT department, so everybody put the mapping and the locations together, and it does come with a caveat on it that don't take this information and think you're safe in an area because the numbers are low, and don't stay away from an area because the numbers are higher in that area. It really is a good snapshot of information, but it's still wash your hands, physical distance, do all the things that we're supposed to do, and again, treat everybody with a little bit of kindness because we're still going through this. And I just commend the doctor and the team at Lambton Public Health for putting it all together and getting it out there. I know it was a lot of work, and how it's used by people will be, I guess, a concern. And I just hope that message goes out. So thank you.
Thanks.
That's a very important message. Thank you, Warden Weaver. All right, if no one else has any other questions for Dr. Renaudet, we will let him get on with his day. Thank you very much for your continued diligence through this epidemic that we're going through.
Thank you.
All right, we are going to move on to long-term care division. There are 2 information reports there, an update regarding COVID-19 update and an update from the Dementia House project report. Can we get a motion for both of those to be received and filed? Moved by Councillor Hand, seconded by Councillor Broad. Any questions or comments about those reports? Councillor Stark?
Yes, this is directed to Ms. Joris. My first question, and actually they're both related, is, and I assume we are continuing to prohibit the movement of staff between facilities. My question is, are we still limiting the opportunity for staff to work outside of our 3 homes in other areas, private homes, all of those sorts of things, and allowing them to come back into our facility? I asked this question a couple of months ago, obviously at the outset, but now that we're into the second wave, it seems to me that we want to maintain that same diligence, and I wanted to make sure that that in fact is happening.
Thank you for the question, Councillor Stark. Yes, we are working under a regulation that's part of the Safe Startup regulation that limits people to work in one healthcare setting. So our staff are required to only work in one healthcare setting. That being said, we do have staff that work in other sectors, in other places. What we are doing is screening, self-monitoring, masking, and using good infection control procedures.
And as a follow-up, I wanted to know if the $3 per hour bump in pay for personal support service workers, when is that anticipated to extend to? Like, are we talking, is this a 6-month program? Is this a year or a full-time program?
So other than the announcement made by the province, we have no further information about the $3 an hour. It's limited only to PSWs at this point, which the previous pandemic pay was for everyone working in long-term care. We don't know really how long it will be. We have not received the money, and we have really not received any direction yet as to how it will be paid out. There are some specifics that have to be worked out around overtime and benefits and that sort of thing. So at this point, we're just waiting to hear more information. I was on a call yesterday where there was some indication that information would be coming out in the next month or so.
So this would be a retroactive type of payment to recognize previous hours worked?
We don't really have any information specific to that.
So it obviously has implications to our budget.
No, it's funded. So just like the previous pandemic pay, the money for the $3 an hour will come from the province.
Okay, thank you.
Okay, any other questions for Ms. Joris? Is there anything you wanted to highlight? Oh, Councillor Hand. You are muted.
I did have a question for Ms. Joris, and it relates to the new position that was mentioned in your, the support. Forget what it was called.
Resident care
assistant. Is that something that has been implemented or will be happening? People can apply for it. I was just curious that way.
Yeah, so it was posted a couple of weeks ago. We had a tremendous response. We don't have the hiring done yet, but we're working on that this week.
Okay, good. Thank you.
I just had one other comment. The adult day program in Petrolia has reopened quite successfully. The reason that we started in Petrolia is that our isolation units are in the adult day program area in Sarnia. So we're working on getting that one going as well, but we're up and running every day and things are going very well.
That's great to hear.
You're full up, Jane? Is there a waiting list?
So we don't have everybody back because we're not able to have as many people in,
You're
in
right.
the area. So, but we've contacted every person and are working on when they can come back.
Great, thank you.
I was wondering, is there a possibility of resuming the one in Sarnia at the YMCA or a different facility that's separate from one of our long-term care homes, or are we utilizing staff?
So we do use staff in the home right now. They're redeployed, but we will be getting that space reopened. It is difficult to operate the day program in another setting. We have kitchen there, washrooms, everything, this separate entrance. So it's fine to open there. We just need to get those isolation units set up somewhere else in the home. So.
Okay.
Or just a comment for that, because I'm involved in that program. There was an opportunity for families to sign up for the bath when they were in the program. So that bath requires, the assistance of the machine, the equipment, and the staff. So you wouldn't be able to do that elsewhere. It was just a service that people could sign up for when the people came to the program to help the families.
Okay. Great. Any other questions or comments about these reports? Seeing none, all those in favor of receiving and filing. That is carried. Thank you very much, Ms. Joris, and thank your staff on behalf of the rest of the committee for all that they're doing. I know this is not an easy time, and we really appreciate everything they're doing to care for our seniors. All right, we are going to move on then to the Corporate Services Division. We have 2 information reports there as well. We need a mover and a seconder to receive and file those reports. Moved by Councillor Cook, seconded by Deputy Warden Marriott. Any questions or comments about those reports? Seeing none, all in favor of receiving and filing.
Just a comment. Again, we talked this morning a little bit about the striking committee and how that would be. It's all going to be set up. It's going to be done through the Zoom meeting. So people in the different groups, Central, North, South, those groups will be put into a chat room, separate on the Zoom call when we go through the striking committee. So they'll have a separate chat room. You'll be able to discuss that and bring it back to the full council for approval. So that will be accommodated that way with setting up the different committees and electing your chair when the committees, they'll also go to chat rooms.
Okay, thank you for that information. Any other questions or comments about those reports? Okay, all in favor of receiving and filing? That is carried. Thank you. And is there any other business? Seeing none, we'll move on to Finance, Facilities, and Court Services Division. We have 4 reports there that are information reports. We need to receive and file those. Moved by Councillor Bushi, thank you, and seconded by Councillor Stark. Questions or comments about those reports? Is there anything from any of those reports that you would like to highlight, Mr. Clarkio?
Mainly just on the 4th report about we remain with a balanced budget. We're utilizing some safe restart funding, but there's been a lot of funding announcements that are out there. But we continue to monitor them as much as possible to make sure that we stay balanced throughout the rest of the year. I think those are the key highlights as far as the 4 reports. That's the one that I really want to point out. There was a second, the other thing I wanted to mention was we're going to provide quarterly reporting on the Bayside renovation. I have Rob King available to answer any detailed questions. He's the project manager there, so we, as part of any large-scale project, we normally do quarterly reporting to keep everybody informed about how things are going. And right now, the construction appears to be on schedule, and we are below target right now. It being noted that the construction on and leasehold improvement budget was prepared prior to COVID.
That's great. I know the quarterly reports are always good information for the committee to have. Any follow-up questions to those? Seeing none, all in favor of receiving and filing those reports. That is carried. We're going to move on to Social Services Division. We have 4 information reports on the agenda today. We have a motion to receive and file those reports. It's moved by Warden Weber, seconded by Councillor Arnold. Any questions or comments on those reports? Ms. Calisante, is there anything that you would like to highlight from those reports?
Through you, Chair. I guess the only thing I'd like to update is just the homeless system response to COVID. We continue to work with those individuals in the overflow shelter, but we are starting to see our numbers go down a little bit based on the efforts of the entire homeless team. So that's good news for our community.
That is good news. Any questions? Seeing none, all in favor of receiving. Oh, thank you, Warden Weber.
Sorry, I guess a comment this past week. I attended the poverty reduction day that was held virtually this year, and it was from the Inaugural Chapter. And just a shout out to all the agencies that are working together to help with the reduction of poverty and the homeless, the Circles group, everybody doing a great job. And it was a different sort of event being held virtually for the first time, but the people are still working and trying to get do everything they can, and it's a great partnership of everybody working together. Valerie and her staff together with other agencies, so shout out to them.
Thank you. And again, on behalf of the committee, thank you to you and your staff for everything that you're doing to help the community through this difficult time. So all in favor of receiving and filing those reports. That is carried. Thank you. Now we are going to move in camera next. For those watching on YouTube, if staff could correct me if I'm wrong, but I believe we will be coming back into open session, but not on YouTube because it'll just be to close out the meeting. I'm not seeing any corrections, so I'm assuming that's correct. I do need a motion to go in camera. Moved by Councillor Boucher, seconded by Councillor Loosely. All in favor? That is carried. We will say goodbye to all of our adoring fans on YouTube.